Hi everyone. Hi Dr. Vrushali.
Hi.
So we'll just wait for a while till others join in.
Sure, sure.
So I welcome everyone for today's session, and we are very thankful to Dr. Vrushali who has agreed to help us and to actually allow us understand the importance of breathing more in depth. So I think a couple of people are still joining in. Okay, so let's just begin with the basic understanding. So I welcome you all, and I'm very grateful that you all have chosen today to, take a step forward in healthy lifestyle. So today we have Dr. Vrushali Dalal, a certified physiotherapist and a diet consultant with an experience of about more than 15 years. She had established the clinic Health Kingdom in 2009 with the prime objective of serving people. And today, with the same objective, she's here with us to help all of us understand what is the importance of breathing exercise in our day-to-day life and how important this is to make your lungs stronger in this uncertain times. So I welcome you, Dr. Vrushali, over here, and we are very grateful that you are here.
Thank you, and thank you all of you for joining. Actually, thank you very much, Saili, for providing, motivating me and providing this platform, because it would be rather difficult if you were not there.
No, thank you so much. And we just begin our conversation with what is the importance of breathing exercise in a routine life? Like, why is it important to do breathing exercises? Because most of the young generation don't believe in it. And I really would like to know more about it from you.
See, what is the life without you don't breathe, right? So breathing is very important.
Yes.
Second thing, it is for mental, physical, and emotional well-being, because if you don't breathe after your anger, it will aggravate.
Right.
So when you take a deep breath, if you are angry, you get calm down, right? So the thing is, if you don't breathe, it is impossible to live. So breathing is crucial as we drink, as we eat, as we do everything, right?
Correct. So I know now I understand that breathing is a kind of food for your body, which is extremely important. And it's important for us to also learn the right way of breathing. So,
Definitely, because if you breathe, you get relaxed. If you breathe, you get healing power. If you breathe, you get good sleep. If you breathe, you can obviously lose weight also. So everything is by breathing. You
wow,
live because you are breathing, right?
exactly, exactly. So now just looking through what is the role of our role of lungs in our body?
See, when we breathe in, the air from the nose travels through trachea, pharynx, larynx, trachea, bronchi, bronchioles, and alveoli. So,
Right.
see, when we breathe in, uh, the lung expands. There are actually more than 65,000 bronchioles in our body and more than 400 million alveoli in our bodies. So if we breathe deep, there is so much to help you out. So
Correct.
the lung plays crucial role for your immunity, because when you breathe, you provide immunity to your body. So deep breathing and role of lung is very crucial.
Okay, so that's really interesting to know, and I was not aware about the numbers of muscles and different things which medical people really look through. So, can we just start with simple exercises, what everyone should do, irrespective of whether they have COVID or they don't have COVID? simple exercise which helps you bring in more oxygen in your body and makes you feel energetic.
Yes, definitely. See, diaphragm, which is beneath your lung, is the primary muscle when we breathe in. So what happens is it is situated beneath your lung, and when you breathe in, it goes down, it pulls itself down, and when you breathe out, it is like it comes back to its position. So diaphragm carries two-thirds of the muscle activity. So it is the
Okay.
main two-thirds of the work is done by diaphragm when you breathe. So it is the primary mover of the primary breathing muscle
Okay.
actually. So first and foremost, your diaphragm should be very strong. So for that, what a person can do is start with diaphragmatic breathing if he is convenient. And see, for breathing, I would suggest that whenever you are sitting or whenever you are starting any activity, you can just take 2, 3, 4 deep breaths, you know. So it is not necessary. You have your own mechanism of breathing, that is all. Just you can, if you are inhaling, just take a pause and inhale more. That is helping your inspiratory muscles and your lung is expanding more. So it is not necessary that you particularly do some exercises or pranayam for half an hour or something. It is day to day, routinely you have to incorporate your breathing exercises in general. So it is not fixed protocol. So if you have prepared good food, you can smell and take deep breath of your whatever food you like, you know. Any flower, aromatherapy is also a running trend. So anything, but just take deep breath in between activities. So not necessarily of any particular form of exercises. You can do it in daily routine and that is needed.
Okay, so as I understand correctly, you should breathe deep breaths at least thrice in one go, and you should keep on doing this in between activities. It is not only that you can do your breathing exercises in the morning, but you should do it throughout the days. So I think three
Yes,
deep breaths is like below 1 minute exercise, something which you can do within 1 minute to enhance your lungs capacity. I
yes, just do it more frequently. Just do it more frequently.
So yes, so okay, I think that's a very good
So
idea. And
definitely,
yes,
definitely yoga, aerobics, pilates, they are form of exercises that incorporate breathing in between. But if you are not ready to do it, you are reluctant or due to some any other reasons you are not doing it, just deep breathing every hourly while doing whatever work you do is great help.
okay, all right. So can we demonstrate some easy exercises or something what a person can do sitting on their workspace or wherever they are?
Definitely, definitely. So first is diaphragmatic breathing. In that, you put your hands on your tummy, your shoulders should be relaxed. You put your hand on your belly. Take a deep breath and you try to inflate your belly. When you expire, you press your belly. Okay? So like this.
Okay.
So all of you, please try to do with me. Inhalation through mouth, your upper body relaxed. You can also relax your legs by lying down or something. Put your hand on your belly. Breathe in, breathe out. So this is the thing you can do.
Well, this is very easy, and I'm sure people around should be able to do it. Honestly, like breathing 3 breaths in from your nose and then holding it for a while and exhaling from your mouth is what Dr. Vrushali wants to suggest. I just have one more question.
Yes, definitely.
Why do you inhale from your nose and exhale from your mouth?
Actually, nose has moisture in it. So, moisture and cilia. So, it will drain out the bacteria, filter the bacteria. So, there are chances that if you are breathing through mouth, there are chances that you take a dry air that is not good for your lungs. And second thing is it will make bacteria enter your body.
Right. Okay. That's a very useful tip, because most of the times when we are exercising, we intend to breathe quickly with our mouth. So something which we can take care of. Okay. The next thing what we would like to, understand more is what and how much should a COVID patient do these breathing exercises? Because, many a times it is overwhelming for a COVID patient when you say you need to do breathing exercise. They are pretty weak in that period.
See, first and foremost thing is don't overstress. If you are not willing to do, don't do anything, just lie down. But in lying down, the preferable position is prone lying. So you lie on your tummy. That will increase the oxygenation in lungs. Actually, during COVID, patients feel breathlessness and their lung capacity decreases. So if you don't want to do anything, just relax. There is good if you lie down more frequently, but you lie down in prone position every half an hour for 10-15 minutes or 2 hours at a stretch, then get up, then do something if you can. But if you can't do anything, don't overstress yourself, because it will rather hamper. Because if you start doing, already there is less oxygen, and you start doing exercises without knowledge or something, you will end up in more of breathlessness. So at the time of COVID, don't overstress yourself. Don't start exercising or doing yoga and pranayam for half an hour at a stretch. Go slow, go mild, and listen to your body.
Yeah, that's so true. I mean, many times people get very anxious if they are not able to do the basic things, what they would do in a normal routine life. But I think overdoing is not a solution. And during this uncertain time, of course, all of us should take utmost care of our health. And as and when required, we should also consult the doctor instead of pushing ourselves hard. Now,
Yes, very necessary.
Yes. Now, the last and the most important information what we would really like to hear from you is, once a patient is infected and fully recovers from COVID, what potential, how much a person should indulge in doing these exercises?
See, when you are recovered, this whatever exercise I am going to show you, if you are normal, then also you can do it. If you are suffering from COVID and little bit recovered, you are able to do exercises, you can definitely do these exercises. But the thing is, don't overstress. Fine? I will show you. One, I have showed you diaphragmatic breathing. That is very nice. Second is pursed lip breathing. In that, you breathe in through nose and purse your lips and exhale.
Okay.
So, the exhalation time would increase and inhalation time would decrease. So, the thing is, you breathe in through nose, you breathe out through mouth with the lips pursed, as if you are whistling. So, this also 2-3 times every hourly. The previous one also 2-3 times every hourly. These both exercises plus some lung expansion exercises. In lung expansion exercises, what you do is, you just put your hands over the apical area of the lung. You inspire and you expire. You concentrate more when you are breathing in over the area and try to inflate that region. So this is apical. and push a bit while expiration. Fine?
Right.
This is one. This is apical breathing. The second is front of lungs. So you can put your hands and concentrate where air is going. You concentrate your mind where you want your air to reach. Inspire and expire. Same way on the sides of the lung. And you can ask somebody to hold your back for posterior portion of the lungs. And while expiration, you just press little bit. So it will help the air to expire, and the next inspiration will be more forceful, and you will be able to inspire more.
Wow, this is really helpful. I honestly, I was not aware of so many benefits of breathing and deep breathing. So I believe most of our viewers would try and incorporate these during their daily routine, and at least the first one, which you explained, would be very helpful for people who are working from home or having long sitting hours to, just get themselves a little more energetic. Moving ahead, the last and the foremost question, which always keeps on tingling my mind, is what is the historical significance of deep breathing? Because it is all around, like people keep on talking about it during the yogic time, and the ancient people were also too much into this. So I would like to just know it more scientifically, why deep breathing is important, and especially in current era where we are all going through this pandemic.
Definitely, as I said, it helps in your physical, mental, emotional well-being. Actually, it helps in your spiritual well-being also. So when people do pranayam for that, right, you connect to God definitely through meditation, through deep breath, because it is a way to God also, you can say. Some people chant Om for that. So that would also help. So everything, whatever Vedas and everybody has said in past is so true in present times. So we need to know the importance of breathing while this. Definitely you go through, whatever ways you like. Like I have discovered my own thing. I like one thing, that is you hold your finger and deep breathe for 3 times and let it relax. So you can hold every finger. So it will incorporate. It is one of the therapy. It is called Jinsen Jiatsu. They hold their fingers and this is for joy, this is for trust, this is for happiness, and whatever. So you do this for joy, you do this for happiness, you do this for whatever things you need, love, whatever. So if you do practice like this by just holding, that is also enough. So every new trend or whatever, what suits you, you do that. That is something very much needed.
Wow, this is super easy, and I think most of our viewers who go through anxiety, they should do it. Like, it's so simple. Just press a finger, deep breathe in, hold it for a while, and let it go. And if it can help you overcome your anxiety, depression, joy, and also enhance, it has medical benefits. I think without thinking, we should do it. Unconsciously, we should do it. But please, at this time, it's important for all of us to take care of our health. I would also request our viewers, if you have any questions, please type them in the question box or the comment, and we will take them up. In between, we will ask Dr. Vrushali to also explain if she could, also enlighten us with some tips about what a person should, drink or do before doing these exercises, or should it just be as it is?
Can you repeat, please?
Yeah, what a person should drink or do before doing breathing exercise or after doing breathing exercise if anything is required?
See, for COVID suffering patients, physiotherapy have a test physiotherapy sessions. In that, we generally recommend them to be in well ventilated space when you are do exercises. Second thing is your clothing should be loose when you breathe because it should not restrict your chest expansion. Third thing is you can always drink warm glass of water before doing breathing exercise. So session goes like this. It is called active cycle of breathing. In that, first of all you do diaphragmatic breathing, then pursed lip breathing, then your chest expansion exercise, and huffing or coughing. That is, so you blowing and taking your cough out, which is very much needed because if you store it inside your body, it is going to harm you. Obviously. So
Of
the session
course.
goes like that, and along with that, we have chest physiotherapy, that is postural drainage. So some special techniques like cupping and that is done by therapists. So for that, you need to consult therapists.
Right. So, like, honestly, everyone has become a doctor nowadays, and it is not a good idea. So, we have a question right now coming in that do we need to hold the breath in between, and how long?
So, to hold the breath, actually, it needs a practice. So, in a one go, it will not come. For pranayam people also, it will not come. So, if you practice this first, like without holding, just increasing your inspiration capacity and expiration, then the next step is to hold the breath. So, the primary thing, if I try right now my exercise, and I am right now holding my breath. In fact, I am harming it rather than helping it.
Right. So, how long should a person really focus? Like 5 seconds, 10 seconds?
See, that's why it should increase gradually. Start with a second or so, then gradually 3 seconds, 5 seconds. Take your time. There are no fixed rules. So you can start with 2 minutes of exercises, breathing exercises, then gradually go till 15 minutes. So don't overstress and jump directly to 15 minutes pranayam. You will feel giddiness or you will harm yourself if you do this.
Right. So we have a second question which says that are these exercises to be done in the morning hours only, or can a person do this exercise anytime during the day?
See, it is any time during the day because if you are a normal person or you are affected, breathing is an ongoing process. So there is no such fixed rule. Only thing is 3-4 deep breaths every hourly or so is good. And if you want to practice some breathing exercises like pranayam or some breathing exercise at a stretch, go mild, you can do any hour of a day with some empty stomach. Don't crucify,
Yeah. I think, yes, it's very important. Don't stuff yourself and then start doing breathing exercises.
Because
You might throw
otherwise,
up.
giddiness will be more and you will suffer from adverse effect rather than helping yourself.
Correct. Okay, we have a question from a person who has suffered from COVID, and he's asking that post-COVID, I get heavy breathing after working out for a very small time. So even after walking, he feels breathless. So how to overcome that?
So it is very important if you are starting with 5 minutes walk, do 5 minutes walk more frequently in a day. Then you add 1 minute more, that is 6 minutes or 7 minutes. Then after 15 days, make your goal up to 20 minutes or so. Don't hurry. So that would help.
Okay, so I think slowly and gradually you can improve your immunity and enhance your breathing instead of just, rushing through it. And
yes. Because post-COVID, and definitely your nutrition plays very important role. How severe the COVID was, that plays an important role. But don't rush. For exercises, I will say that start with 5 minutes, go for 6 minutes, then 7, then 8, then gradually to 20 minutes or whatever your goal is. But achieve it slowly. Don't rush.
Okay, we have a next question which says any specific exercises for COVID patients with pneumonia?
Yes, definitely. Actually, see, there are two type of that is restrictive and constrictive lung diseases, COPD. So it is according to your blockage area or on the lung, or so you need to be specified if you have pneumonia. But basic exercise remains same, like diaphragmatic exercises, lung expansion exercises, that remains same. So go to that, do that. You can do it at home safely. But if you want further enhancement in your breathing capacity or so, you need to consult somebody like doctor or physiotherapist, and you can go specific, because it is not pneumonia specific exercises or some COPD specific exercises. But these three exercises which I show you are run for all.
Okay, so I would just like to, ask you to explain all the three exercises in a sequence to make sure all our viewers are clear about it before we close the session.
Sure, sure. So first is diaphragmatic breathing. In that, you put your hands over your belly. You inspire to nose. Your shoulder should be definitely relaxed. You inspire to nose. You expire to mouth, right? So this is first one. The
Okay.
second one is also you should be relaxed actually when you are doing breathing exercises, because it is helping you to relieve your stress and more make you relax, right? So your
Yeah.
position should definitely be very comfortable. The second is first lip breathing. That is, you take inspiration through nose and you expire through mouth. As if you are whistling or blowing something, you can take paper, you can increase the size of the paper. So it is, how you are progressing, you will know. So it is so much of a thin paper, then you take thicker paper. In diaphragmatic breathing, you can put some sandbag or something heavy. You breathe in, you inflate it, you expire, you relax. This is the way to make it more with resistance. For lung expansion, you started with, putting your hand. Then what you can do is you can take some resistance band. Sorry. And you expire. So it is increasing resistance. You are working your muscle. You are incorporating with them with more of the resistance. So there are multiple ways, but at which stage you are doing is very important.
Correct. So I'm sorry, but there are so many questions. So one more last question before we close is, due to the sedentary lifestyle, most of the people are not able to do the breathing exercises. And could you recommend something to, actually inculcate it as a culture of, one's lifestyle, to make sure that they do deep breathings in between, or how a person should do the work-life balance is a question actually.
Uh, if you start, you are going to office, you start by 9, go 9, sit on your chair, do 3 of diaphragmatic breathing or pursed lip breathing. When you stand, you can just put your hands, you can inspire, you can expire. With lunges, you can inspire, you can expire. So there, it is, there is no specific time you need. It is just you breathe daily. You do it every second, right? So you can do whatever is needed, like every step you can do breathing exercise. There is nothing specific you need to do. Just taking deep breaths, it is definitely going to help.
Yes. Okay. There's one more question which says, while my COVID period, if I take deep breaths, I would get coughing. So, what is the reason behind it?
See, it is lung congestion because your mucus gets collected over the specific parts of the lungs when you have COVID. So what you need to do is drink plenty of hot fluids, especially water. You can add turmeric also. Then you start active cycle of breathing as I taught you. Diaphragmatic breathing, pursed lip breathing, chest expansion exercises, and huffing. That is, so you need to blow out the mucus or cough which is collected. That will definitely help.
Okay. Thank you so much, Doctor, for sharing all the informative uh, insights about breathing and how important it is for everyone. I also thank all the viewers for joining us today, and I'm sure you've got something to learn throughout this session. I hope you all start at least with simple 1 minute or 2 minutes breathing exercise and stay healthy, stay safe, stay home.
Thank
Thank you,
you.
Dr. Vrushali.
Thank you so much.